So New York City, and Fran referenced it earlier, municipalities across the state are confronting homelessness, record homelessness here in the city, given our very vibrant and overactive real estate market. And so I want to sort of ask you folks about how do you think we should approach this crisis, and what role you think supportive housing will play in helping your agencies confront the crisis, both here in the city and across the state. So love, Kristin, to hear your thoughts on that, Daryl as well, and Bob and Jason, if you'd like, as well.
Sure. You know, I think what's become more and more clear as time goes on, as New York, just as every state in the nation, has faced significant economic distress for a number of years in the recent past. I think the one clear thing that has emerged from all that is that there is no one answer to addressing homelessness. There need to be strategies in place, and they may need to be different strategies, especially given the geographic diversity and the demographic diversity and realities in New York State. There may need to be different strategies both in preventing homelessness from taking place in the first place, and in addressing homelessness once it has taken place. I think one thing that we do particularly well in New York at the state level and at the city and county level really is to recognize that homelessness is typically not the only thing that is facing a household, whether it's an individual household or a family household, and that there needs to be a multi-pronged approach in working with each homeless individual and each homeless family to really address what's going on. You know, economics may be the root cause of homelessness, but there may be other factors in play in the household that made a particular family more susceptible to the economic duress of the recession and its resulting in homelessness. And there may be real barriers for that household in order to be able to achieve and maintain stable housing. It's not necessarily as simple for every household, as you all well know, as putting a roof over one's head. I think the partnerships that you see demonstrated here and the partnerships that we have with city agencies and agencies in counties throughout the state are really critical in helping to develop and to roll out these multi-pronged approaches. You know, it's about housing development, obviously, and I think you're hearing today about resources that have already been brought to the table, and then you're hearing some inklings of potential resources that will be brought to the table in the future, both in terms of future MRT allocations, a potential for a New York 4 type agreement. So real commitment to bring to both keeping the resources that are already in play available, and sometimes that's not the easiest of tasks, particularly, frankly, at the federal level, where we are seeing trends, unfortunately, at the federal level that are going in the wrong direction related to housing and other funding that we use to put together an array of supportive services and supports, and also to make sure that there are then operating supports and operating funding in place to provide the services that are necessary to create a stable environment. And all of those pieces then, once they're in place on the housing side, I think then get a household ready to tackle other issues such as substance abuse, mental illness, barriers to employment, and those kinds of things. So really, I think it's a multifaceted approach, and I think that we have a lot of pieces, and through the MRT work and federal waiver opportunities and other things, and through what is shaping up to be a very ambitious agenda in the city under the new mayor, those are all pieces that will be brought to the table to continue to address homelessness.
I think if I had something to share, I would say that it's not always about the resources either. Yes, we need to make sure that the resources are available so that we can achieve success, but it's also about true cooperation, true partnerships. We know the difficulties that you have in dealing with just one state agency. So to deal with multiple state agencies probably is going to make you pull out your hair, which I've had some experiences in the past on. But I think that through us working together and recent examples that have led to success gives us the feeling that we can do this over and over and over again. Let me give you one example. Homelessness, of course, is wrecking New York City is definitely a challenge here. But when you go to some of the smaller communities upstate, although their homeless situation is less, sometimes because the main street is only 3 blocks long, you can see it a little bit better. And all of us here at the table work together in order to bring a solution to the Finger Lakes community of Cazenovia, in working not only as state agencies and local agencies, but also with the federal government that provided some land on a VA property, that we were able to work together, put our resources in order to create housing for people who are at risk of homelessness, in particular the veterans in that area. And it was a success that everyone came around and said, wow, this is innovative, this is the type of thing that needs to be done. And you would think that it gets done all the time, but no, it doesn't. But because of that success, I think that we can look to replicate those types of models around. So resources are important, but I think it's also about true partnerships, true cooperation in order to make sure that we can get to some of these achievements.
Great. So we all recognize that supportive housing has been extraordinarily successful in dealing with homeless, vulnerable populations. And recently, over the last 9 years or so, we've expanded, and supportive housing has become we've talked about, a key tool in the state's arsenal to responding to a variety of different problems, whether it's reducing Medicaid costs or reducing institutionalization in hospitals and psychiatric centers, responding to old goals, revitalizing communities. So how might the state expand its efforts in supportive housing in each of these areas to meet these new demands? And at the same time, how do we ensure that supportive housing remains a key tool in fighting homelessness across the state? So maybe Jason and Bob, you could take a shot at that question.
Sure. In terms of, I think that the next exciting opportunity is, while we will continue to grow our supportive housing program, really what needs to happen if we want to sort of supercharge this effort is to fundamentally change how we purchase healthcare in the program. The traditional way is that you pay for services provided if it's a Medicaid member and it's a service that's allowable either the state directly or through one of our managed care partners, purchases that service, pays for it on an incremental basis. The problem with that approach, which is sort of traditionally how the United States has funded its healthcare system, is that it rewards ever more levels of service, and none of those payments are actually linked to whether or not the person who received the services is getting any healthier or that their lives are improving. And in fact, in many ways, the current system creates very perverse incentives, whereby which providers are actually better off financially the sicker individuals get and the more needs that they have, the more services that they need to receive. And so what we're trying to do in Medicaid, and it's not a small change, major structural change, is to fundamentally change how we pay for healthcare. And that change is, I think, going to offer up some opportunities to really take a different look at how we meet the needs of the population and the communities in which they live. And this is already starting. There's efforts across the country to try to bring providers together and give them, in essence, a global payment, a per member per month amount. And out of that, give them tremendous flexibility in terms of designing very patient-centered solutions to meet the needs of the population. Very fundamentally different way to pay for healthcare services than what we have traditionally done here in this state. And that future state is not that far away. We're probably 3 to 5 years away before we're going to have these new systems, these collaborations called performing provider systems, who are all going to be sitting around a table thinking about how collectively they can better serve the communities in which they're located. And while there's a lot of work that needs to be done, I just want to encourage all of you to think about how you can be part and parcel of those new systems that are emerging as we speak. And what you can do in those environments is take those dollars and use them much more flexibly, including potentially using dollars directly for housing-related costs, which has really been the fundamental challenge. And while there's so much research that shows how much cheaper it is to provide housing subsidies with services than it is to have someone on the street with diabetes and significant persistent mental illness and substance abuse issues who cycles in and out of an emergency room 50 times in a year, is admitted into the hospital 5, 6, 7, 10 times in a year, where a person can cost hundreds of thousands of dollars to taxpayers and to the Medicaid program. And if we only just could fund some basic services, address their housing and mix that with vital services, that we could really generate lower costs and much improved outcomes for that person. That environment, which historically not been available, is going to be available in the future. And I think that all of you need to position yourselves to see how you can function in that world. I'd say the challenge to all of you, and I said this in a recent meeting with Ted, is we have to think about, as these providers are coming together, we need to think about how we can present supportive housing solutions to these groups of providers in ways that they can absorb, the ways that they can interact. Try and keep it as simple as possible. These clinics, these hospitals, they don't know housing like you know housing, but they need your services. And so we need to think of turnkey solutions. We need to think of ways that you can provide access to these services in a very quick fashion. And I think that's going to be one of our collective challenges over the next 3 to 5 years. But I think it's very exciting, potentially major game changer in terms of access to funding. I mean, Medicaid is a $55 billion enterprise. I mean, it's the largest human service program in the state. It's 40% of the state budget, and we have an opportunity to fundamentally change how it purchases care in ways that could really free up millions, hundreds of millions of dollars every year to go into alternative solutions to care, such as supportive housing. So I think very exciting days to come. I think there's a lot of opportunities here, and the next few years will be really essential for us to work together.
Okay. Bob?
Yeah, just to build on what Jason said, the way the healthcare system is being restructured is incentives are really being put in place both to drive behavior of the managed care companies and the networks that are coming together through health homes and performing provider systems. And I think you all realize more than probably anybody else that you're not going to be able to manage somebody's health and disability if they're not housed. So incentives are going to be put in place so that both health plans and provider systems will be rewarded for keeping people out of the hospital, and the metrics that measure their good health moving in the right direction. And we have to help them realize that you're not going to be able to achieve that if people aren't stably housed. So I think you're going to see a different incentive structure on the health side that's really going to want them to partner with you and have them reach out. But I also think that you should be reaching out to make that point. So that's one thing. Again, join these systems, but you shouldn't be begging to join. You should be saying, you really need me if you're going to produce the results that you're going to be asked to produce. And you're not going to be getting your incentive payments if you don't produce those results. That's what's really the district proposal does. If you look at it in the out years, you don't get the dollars if you don't produce the outcomes. And housing is going to be a critical piece of that. The other thing is, I think collaboration across the state agencies is going to increase. We're asking you to collaborate on the ground, and we're collaborating more and more every day on the state level. Our housing director, Moira, works very closely with HPD and HCR. Every week she's talking to key staff that I actually see in the room here from the various agencies. I think we all have our staff here in case you ask us questions we don't know the answers to. And I think you're going to see that happening more and more. Now, the last thing I wanted to mention is that I remember going back to previous administrations in the city. The city was very helpful in identifying housing. I think some of you that have been around a while remember the IMREM housing resources that we're able to use. Now that's long gone, but this morning it was announced by the mayor's office that they intend to use any resource at the city's proposal to put property or vacant buildings on the table again. And I think that down here that's going to be very, very helpful because it's so hard to find areas where housing can appropriately be developed at an affordable price.
Jason's excitement and passion about Medicaid and Medicaid savings gives you some inclination of why it's such a hot topic among us and why there's sort of real traction on it.